So being a Black birthing person, a Black woman, and seeing the perceptions of like how we're viewed as individuals, right? So I can't remove myself as a Black woman who sits before you right now from everything else that happens to me in my life, right? And I can distinctly remember at the age of 16 having my like first real major like discrimination happen. You know, even as a Black doula coming in and supporting clients of color, I'm oftentimes not listened to. So just based on that, I was like, something has to change, you know? And so one day, I put a call out on a listserv to birth workers, and I was like, is there anybody who wants to work with this population, like low income, women of color, those who are undocumented, those who like are looking to center the humanity in folks? And about 23 doulas showed up to my house. And it's a beautiful thing, right? Because we all had the same thing. We were seeing something that we wanted to address in real time, which was the fact that people were being dehumanized within their birthing experiences. And they still continue to be.
My first time, it was just my husband, you know, who was very supportive, and I had a plan, or I was told to have a plan.
Right.
But I had 3 different doctors the first experience because people were switching around. I could never, I didn't build any type of relationship. And so even if, you know, what plan I had, it was conveyed to, you know, different people.
Yeah.
Things lost in translation.
Exactly. And I think you learned that the tough way the first time. That if you abandon ship, everybody else is gonna be right behind you, like we in the water, sis.
A lot of people don't even know what a doula do or who a doula is, and the resources are not out there for doulas. Right. And so I think that could be a major change if it was out there for people to know and learn the benefits of it.
We talked about getting back into the community. So not only having the resources in the community, you also have to have the education. You have to educate the community on what a doula is, what they do, what services they provide. As well as what a midwife does, because we also have that issue, myself being a midwife, and you know, there's always this kind of old thought that, oh, they used to do that in homes down south. We do them in homes up here. And so we also do them in hospitals, and we also do them in birth centers. So really expanding their knowledge about who we are and what we do is important.
If we are teaching our families to advocate for themselves, to be educated, to ask questions, and to trust in themselves, they have to be able to interact with a system that's going to accept them as people who ask questions, as people who advocate for themselves. And then also making sure that people know about them, you know? How do I know which place I want to go to? How do I know which provider is good for me? And if we're talking about this starting in the community, are people in my community talking about who is eligible or who should birth at a birth center? Can I lean on people who have had both positive and not so positive experiences with a midwife in a hospital, you know?
I also think another key component is to be able to trust. Because even though we may have these different resources, can I trust that if I show up, will you be able to support me? And do I have the opportunity to make the selection? So what if I want a midwife? Or what if I want a doctor? You know, make the decision how I feel about it.
Which is why we have to center the Black birthing individual and family.
Right.
When your care is centralized to them and then focused on them, you know, things that we notice, postpartum hemorrhages and, you know, unnecessary bleeding and procedures and stuff like that. If we focus on making sure those things don't happen and be very proactive as providers and doulas and families being educated and knowing what that can happen, it can carry over the entire system.
Absolutely.
And it will become the norm of how we care for patients. And so you'll see a drastic decrease in those health disparities, not only among Black patients, Hispanic patients, but then you also see them for other ethnicities as well.
Yeah.
Absolutely.
I'm Black in this hospital. I don't feel safe. And I don't feel loved. And I don't feel like I can let my guard down. Because I'm worried about if my baby is going to be taken from me. I'm worried about if I'm going to be mistreated. Is my doula even going to be allowed to be with me during this time? If you ask a person, like, are you interested in culturally aligned care? They're gonna be like, what?
Mm-hmm.
You mean, do I want a provider that's Black? Yes. Yes, I do.
When you hear people say that they just want somebody that can relate to them culture-wise, it's more of them feeling like comfort due to them feeling like they are ignored or not understood. So I think that's a lot of that, because I hear a lot of people that actually say, I'm looking for a Black therapist, I'm looking for a Black doctor, or what have you not. And it's just mainly not just for the trust, they just feel like everybody cannot relate to where they coming from.
Two years prior to me becoming pregnant, I happened upon a Natural Birth Expo in Union Square. And I happened upon a Black midwife and a doula. And I was like, really? I didn't even know Black midwives still existed. And she was like, oh no, we're here, see? And because in my mind, the context that I had for midwifery was based on something from a book. You know what I mean? It's something that you see on TV, it's something you read about that happened in the past. It wasn't something that I was privy to. You know what I mean? I had never heard of anyone talk about midwives in real time. And so at the time, I wasn't thinking about becoming pregnant, but I was like, well, just in case, I'm gonna carry and hold on to this stuff. So I did. And then about 2 years later, I met my husband in Brooklyn. A couple months later, we were pregnant, and I went to an OBGYN of color. So I thought that because I had someone who looked like me, that was enough in terms of the care that I wanted, right? So we're seeing her, but there was just no vibe. There was no energy, there was no connection. It was just very sterile, the interactions. It just wasn't something that was coming easy. And so we were like, no, we need to find another provider. And then I remembered I had this information, and I went on MySpace and I found that midwife and I found the doula. And once I went into her care, it was totally different, like totally. This is a Black midwife who I come out of there, she's sitting with us for an hour, right? An hour's time, really getting to know who we are as individuals. And she was like, it's more important for me to know who you are so that I can be able to support you when it comes time for your birth, because it's not just about the physical stuff that's happening to you. You have to take an opportunity to really sit with someone. It's not just about what's happening in their body. That's a reflection of what's happening on the outside too. All the experiences that they've had since they've come into the world from someone else. And you can't separate, just what's happening to someone physically and not see the emotional aspect of it and not get to know who they are as a human being. Like to me, that's not normal. That's not care, you know what I mean? Like, we're not robots. People are not robots.
Knowing that the numbers that you see and you read about, Black women are dying at this rate, and you're seeing that, but yet I'm seeing something different when I'm in the birth room and I'm looking at them push their babies out, and it is amazing and it's powerful.